This is the MFS Wellness Podcast. I am Mike Sinopoli, and on today's episode, we're discussing the normalization of the overindulgence in prescription medication and how we can rely on more of a lifestyle medicine approach when it comes to preventing chronic illness. Joining me today is Dr. Sunny Sharma. Dr. Sharma is an internal medicine doctor with Ascension, Illinois, in Hoffman Estates near Chicago. He provides personalized primary care for conditions that affect adults as they age. Dr. Sharma, thank you for being here, sir.
Thanks for having me on here. I've been taking a listen to a lot of the stuff that you have. It's very practical. It's very to the point. So I'm happy to be one of the voices that you bring on. Something I do want to also highlight in what you mentioned, I'm not only an internal medicine doctor, but I'm also a lifestyle medicine doctor, which there aren't too many of us around.
Okay. How does an internal medicine doctor and a lifestyle medicine doctor, what are the differences between those two? Is there a difference there?
So the traditional internal medicine setup, and actually in all of medicine, the first thing they always teach us in medical school, if someone has high blood pressure, cholesterol, and all those things, it's supposed to be about telling them about diet and exercise. The problem is our current medical system doesn't give us enough time for that. So lifestyle medicine actually gives you more of those tools and those assets so that you're not just telling someone move more, eat better, because as you know, if you go on the internet and you Google what's a healthy diet, there's about 100 different varieties, and the vast majority of them are wrong. So you need someone that actually has the knowledge and the know-how to kind of bridge that gap.
Yeah.
And that's why I went into lifestyle medicine. I wanted to make a deeper difference and not just throw a prescription on top of everything. And I'm not saying every internist does this, but this gave me the skill set and the backing to be able to go above and beyond for my patients.
That's cool. So you're maybe spending a little more time with them in that case and getting a little bit more deeper into their individualized needs than a traditional doctor that would just maybe write a prescription and say, here you go, and exercise and diet. So I think that's so important. I mean, we kind of have this, it feels like we just have a medicate first society right now. It just feels like that not only maybe do doctors do that, and I don't like to do that. I know doctors sometimes can get a bad rap, and maybe, in any profession there are, better and good and corrupt or whatever. But is that kind of, when you go to medical school, is that's sort of kind of how it goes? You don't get a lot of nutrition information, or you're not doing a lot of classes for nutrition, right? So it's just basically you're practicing medicine, right? Is that kind of how it goes?
Yeah, so there was actually it was implemented that in medical schools they had to have 25 hours of nutrition training, but that's 25 hours over 4 years. And there was actually a study that was done. I forgot when it was, but in it they actually interviewed about 100 med schools, and about 90% of them weren't even hitting the minimum requirements, and the vast majority of them that were. They were doing it during the basic sciences, which is the first 2 years. And those are the years where you're not even interacting with patients yet. So it is as relevant. And to be honest, I know there's a big push. Now we're going to do 40 hours of nutrition training. I don't think that's going to change anything, because you can have all the nutrition training in the world, but if you're still forcing doctors to see patients in 10 to 15 minutes, when are they going to have the time to even use nutrition training?
Yeah, exactly. And I don't ever consider myself even close to a doctor, but I work with clients in a fashion weekly. We're texting, we're having Zoom calls for an hour plus, and we're going through deep macronutrients and everything to do body composition stuff, because 80% of chronic illnesses can be eradicated just by not being in an obese state. So I love what you said on your site, on your website. It says the best medicine isn't found in a prescription, it's found in prevention. I really like what you quoted there. And so, like, with your patients, then are they coming to see you in a preventative way? Are they coming to, or are they already maybe had something and then coming back to you? What type of patient would you see being this type of doctor?
So I have a pretty broad range. Right now, my oldest patient is 102, and I have patients that are still just teenagers. Obviously the 102-year-old, she's had a long life that has some medical problems that we're addressing, and she has a lot of needs for that. And I have a lot of patients that are like this. They have multiple medical problems. The common ones that we always see: heart disease, strokes, diabetes, high blood pressure, high cholesterol, various cancers. And then you have the people that have seeked out a lifestyle medicine doctor to be proactive, to not let those medical problems happen. And, in a perfect world, I would have loved to have reached each of these patients in that state where I could jump in and try and intervene. But I take care of the entire spectrum of things, and I'm prepared to do so. The cool thing is, for the people that even have the medical problems, we're looking at treating those, hopefully reversing some of those. But the stuff they don't have, let's start working on the prevention there.
Okay, I love that. And that's really cool. So when did you make that switch recently? Were you at first just a practicing medicine like a standard physician, and then just what led you to make that change? What was your motivation?
So I have a pretty long story of my medical background. So I grew up in the northwest suburbs of Chicago, and I actually started practicing out of the same hospital where I was born, St. Alexis Medical Center. I was the
Okay,
first doctor to be born there to come back practice there. It was
cool.
a pride point. I always wanted to be that traditional community doctor that took care of the people, primary care setting. And I had a practice where I used to go office, hospital. I would even see people in the nursing home if they went there or if they needed to go to rehab. And I was just churning people out very quickly because that's what the process is. You had to get people in and out. And I was rounding in the hospital one day, and this patient of mine that was there for a heart failure exacerbation, we had a long conversation. I'm walking out, and then this pizza delivery guy was walking in. And I stopped the delivery guy. I'm like, wait a minute, did you mean to go to like the break room, the nurse's station, or do you have the wrong place completely? He showed me the name and the instructions, and it was my patient's name. And it was also that room.
Mm.
And this was a patient that came in and out of the hospital every month with a heart failure exacerbation. And so I ended up talking to him for another hour afterwards, explaining why this was the stuff that was putting him in the hospital. After I finished with the patient, I needed a break. I was like, I need to go to the cafeteria. I need to grab something to eat. And I go down there and I look around. I see patients' family members. I see nurses, doctors, CEOs of the hospital. They're eating the same junk that is putting the people in here. Like they're having just that's all it is. It was wings, fries, burgers, pizza. And I'm not saying that those things are off limits, but that's the only stuff I see being had. The salad bar isn't even being touched, to be honest. And I decided that I'm not going to eat anything. I lost my appetite. I finished my work. I went home and I told my wife, I'm like, you know what? I don't think I'm making a difference. All I'm doing is patchwork here. And we talked for a while, and she's like, if you don't feel like you're making a difference, then like do something about it. Find a way to make a difference in that way. And we ended up watching like documentaries, which I don't tell people to get your medical advice from a documentary, but I ended up watching one that kind of hit home. That it's like, you know what? I think I need to make diet changes not only for my patients but for myself. So this was back in 2018. Literally the next day, I started making changes and heard about the American College of Lifestyle Medicine because I stayed up all night researching things. And I decided that I wanted to go down this process to become certified. Things got a little delayed because the pandemic happened, but I ended up getting board certified in lifestyle medicine, and also cleaning up my own diet in that type of way. I wouldn't say I was 100% there, but I was still working through a lot of those type of things. And then it came down to 2022. I thought things were going well. I was still practicing in a traditional way. I just shifted only to the office setting. And I ended up having a medical scare of my own. I was actually diagnosed with the brain tumor. So that's why I have this nice little scar here. It was called an acoustic neuroma. It was this large golf ball size tumor that was just sitting back there. And everyone was blown away that I didn't have symptoms. They thought it might have been a little bit to do with my lifestyle at that point. Um, in that situation, I had to find a surgeon that was going to operate on me and give me the best chances of doing well. I was given all these poor outcomes. I was told that because it's growing out of my balance nerve, that I would likely be unsteady. I'd be more prone to fall. I was told that I might have a chance of like a mini stroke, so I'd lose motion on my right hand. I lost my hearing. That was a guarantee that was going to happen on that side. And there are various other things that I was told that would happen. Like I would probably be throwing up after the surgery because I'd feel so unsteady, like it was terrible vertigo. So I ended up going to UC San Diego, that had the #1 acoustic neuroma program in the country. They did 162 surgeries. I was told the surgery would be 6 to 8 hours. My tumor ended up being much more complex. It took 14 hours. It ended at 3 a.m. And they said it was the most difficult tumor they had that year. When I woke up, I was prepared to be dizzy and nauseous. And I remember waking up at about 5 in the morning. I'm looking straight ahead. There's a clock ahead of me, and I see everything clearly. And then I'm looking around the room for other things I could read to see. And it was the opposite of what everyone told me. Everyone's like, you're going to be so unsteady, you can't focus on anything. Then in the morning, physical therapy, occupational therapy, and speech therapy all came in. And they ended up evaluating me, and they cleared me within minutes each time. After a 14-hour brain surgery, I stayed in the hospital 2 days and I was discharged. I was
Wow. Wow.
and the thing is from the moment I was diagnosed to when I had the surgery was about 3 months. And what I did was I'm going to use my knowledge and implement it for myself. I'm making myself my own patient. And I doubled down on my nutrition. I made sure that I was getting the appropriate macronutrients, micronutrients. I was trying to stay lean. I was staying physically active by exercising very regularly. And the only thing that that everyone could think of was why did I have such a good outcome and such a complex tumor and such a big surgery was the fact that I had taken care of myself lifestyle wise. And it from that moment on, I just kind of kept riding that out. I went from being told that I might be unsteady to walk to in 2024, I ran the Chicago Marathon.
Wow.
And I'm not a marathon runner. I've never run a marathon before that.
Sure.
Chances are I'll probably never run one again because I'm just not into running. It was just something that I wanted to prove it to myself after the surgery.
Absolutely.
Um, yeah, so it was a bit of a long process, and each step of the way got me closer and closer and closer to where I wanted to be, and that's why I made the shift. But last year, I realized that I wanted to dive even deeper with my patients because I was still struggling to have the time to talk to them. So in May of last year, I transitioned into a concierge style practice where instead of my 3,000 patient panel that I used to have, I'm only taking care of a few hundred now. And in that, my shortest visit is 30 minutes. And I have some visits that go as long as 2 hours. And I get to do these deep dives and I get to talk about the nutrition. I get to talk about various things exercise wise. I get to talk about the differences between zone 2 and VO2 max. But I also get to deal with these complex patients where, like, you know what, they just need momentum to get started with movement. So if I start talking about those things, it's not going to work. It's not a one size fits all. And it's been life changing for me because it's been more rewarding, but it's also been life changing for a lot of these patients. I mean, I just saw someone last week that has lost almost 100 pounds since I opened the clinic.
Wow.
And it's because they've been using me as their doctor, their coach, and nutritional expert in that way. And it's been phenomenal.
That's just absolutely incredible on all ends. Your your entire journey there, the scare and what you did and what you're doing now to help people is just kind of one of those things that just kept progressing. And it's just like music to my ears to hear this kind of stuff that this is happening, you know. And I was going to ask while you were speaking, the insurance that goes, does insurance cover lifestyle internal medicine? Is that something that they still do? And because I don't know, because it seems to be a little off brand from usual medicine. So does insurance handle that? How does that work?
So it's billed like a normal medical visit, but the reality is, if I'm not prescribing something, um, you bill at a lower level. Which I'm not saying that everything has to be billed at the highest level, but if I do the quick route of, hey, here's another blood pressure medication, here's a diabetic medication, traditionally you're able to bill at a higher level, and that's how people stay financially viable in medicine, especially since they keep cutting reimbursement. From a lifestyle medicine standpoint, I have to sit there and I have to talk for over 30 minutes with the patient for me to bill for that same level that I saw someone for 5 minutes and gave a prescription to. So you see where the system's pretty broken here.
Yeah.
With this setup here that I have now, I don't really worry about what I'm billing for. Everyone pays like this annual fee, and then I have like I do the billing codes for each individual visit. But it takes the stress off that I'm not worried about. I have to see 30 to 40 patients a day to make sure that I'm paying the overhead and then I can continue to provide good care.
Right.
I'm actually able to focus on the people. So is there reimbursement? Yeah. Is it great? No, it's not. And that's why you have to get strategic in how you want to do it, especially if you truly want to do what's best for the patients. And that's what I'm going for.
I got you. That's awesome. That's it truly is. And what are some things like I guess to for you? What did you do to change? Let's talk post-op. mostly?
Hmm.
Because I know you said you started up in 2018, but 2022 really came to scare. Um,
Hmm.
it hits home to me because my mother has had a brain tumor, and
Hmm.
she's diagnosed in 23 with that, and she's stable
Hmm.
now. She's stable. She has a little bit of the foot numbness that happened, but
Hmm.
not to get too deep into that. But for somebody like my mother, I guess, what would I what was something that maybe she could look at, or what did you do, and then are you using the same thing for patients for somebody that's recovering from this?
Hmm. So the first thing I start focusing on is let's try and focus more on whole foods, the real foods, less of the processed stuff. The reason why I start with that is because the next thing I start talking about is protein. I want to make sure people are getting enough protein so that your body could heal from surgery as well. And I usually shoot for about 1.2 to 1.6 grams per kilogram because that's what a lot of the science says, especially for people that are working out or active in that type of way, or healing and growing. So I think of it the same way. You're growing muscle, you're breaking them down, you're healing them. Same thing when it comes to surgery. You're healing tissue at that point. The problem is if I start with protein, then people start looking at things like, oh yeah, these protein pop tarts, right? And then you got this protein cereal and protein this they're putting protein in everything, and it's like, but people aren't paying attention to the fact that this is still 90% junk. Just because they add a little protein to it
Hmm.
doesn't mean you're not getting all that high sugar, all that extra processing, all the refined flours and things like that. So I start with talking about let's have you have whole foods. Try and think about what your grandparents ate back in the day. Like
Right.
they didn't have constant drive-throughs and all. 90% of the grocery store packed with packaged goods for us. They actually had to make stuff, or they at least had things from cans, which I'm not opposed to canned foods if you have the right ones, and I talk people through it. But that's usually what I start with is I want you to make sure that you're eating more natural stuff, more of the whole foods, you're getting enough protein. And then I also talk about fiber. Fiber is one of those huge things that's underrated nowadays. And I always talk about people getting like fiber first proteins. And the way I describe that is like foods that tend to have both. That have both in them. Like even if I have a bread, I tend to have like a true whole wheat. Like I use Dave's Killer bread, so it's actually high in protein and fiber for bread, and it's actually giving me a lot of the phytonutrients and the things that are good for you. A lot of people just jump straight to those low calorie breads that are. I mean, it might as well just be cardboard a lot of times.
Hmm.
So I started talking about like let's find sneaky ways to get fiber in, and it's like if you're having the whole foods, if you're eating fruits, veggies, beans, nuts, seeds, these type of things, you're getting that stuff in. So those are my primary focuses when it comes down to that. On an individual level, I will often talk about individual vitamins, but a lot of times I like to know those certain levels as well. I don't like just blindly giving blanket statements, except for just a few rare exceptions.
Hmm.
It truly is individualized.
Right. And you think the recommendations are accurate for what the FDA says? Because the FDA on their site, they say 54 grams of protein for people. And I don't think that's anywhere near where we need to be. I think three times that at least. I
Hmm.
think that may be just enough to sustain life, but not what's optimal. Is
Hmm.
fiber around the same? I know it's maybe about what, 25 grams for women, 35 grams or so for men. Is that what we want to target? I believe that's close.
Yeah. That's roughly what we're trying to target. I usually shoot for ideally 30 for women and 38 for men. There's a lot of studies that show the benefits there, and there isn't really an upper limit. People can go higher and higher. There's even some literature showing benefits, especially colon cancer risk, if you get above 50 grams of fiber. Now the difficult part is if someone is well below that and they jump straight up to 50 grams, they're going to have some GI issues. So I talk to
Okay.
people about working their way up. So yeah, from the fiber standpoint, they're not far off. The USDA regulations are not that far off. The problem is, it depends on which survey you look at. Up to 97% of the U.S. population that are adults do not get enough fiber.
And it's a
It's
tough
an
one to hit. It's tough to hit.
it's an it's an insane statistic. It really is a tough one to hear, considering how beneficial it is, because it helps regulate glucose. It helps keep your blood pressure low. It lowers your cholesterol. It helps keep you full. I mean, it helps lower certain types of cancers. So there's a lot of benefits there.
Right.
As far as the protein goes, yeah, the 54 grams, it's based on like the average weight. And then I think it was about like closer to zero point 0.8 grams per kilogram at that point. that's a little low. Like you said, kind of for survival. In an ideal world, I want everyone exercising and moving their body, and for when it comes to muscle synthesis, I want everyone at a minimum at 1.2 grams per kilogram. And then I usually try and edge closer to the 1.6. There's a lot of data on that. After that, there is some marginal benefits, but 1.6 is kind of like this golden number on a lot of studies.
Right.
The latest USDA guidelines, which I mean, there's some good things. There's a lot of things that they just definitely missed the boat, but they did. That was one thing that I was happy that they did bump it up, recommending the 1.2 to 1.6 now.
Yeah, I like that. And I think too what you were saying before about those processed protein bars and all those little protein candies everywhere. Not only are they packed up with sugar, but I hear that they use a inferior style of protein, maybe a collagen or something like that to call it protein, but I don't know if it's a complete protein because they have to have all 9 essential amino acids and all of that. So I would say, what do you think is a good number? Obviously, 100% is the best to get your protein in from whole foods, right? Probably what,
Yeah.
80 to 90% maybe to give some leeway.
Yeah, I do. I go 80 to 90%. Actually, most dietary things I tell people, if you're about 80, 85, 90% of the way there, that's enough. Gives you that little bit of wiggle room so you don't
Yeah.
go 100% all in and then crack,
Yeah.
which is very commonly what happens.
That's so
Um,
true. The adherence
yeah.
goes,
So,
the adherence goes when you go try to go 100%.
mhm,
That's what a lot of times it's like, we also focus on perfection a lot in this country, especially with
mhm.
diets. Like we have to be right on point, 75 hard, all these different things, cleanses, detoxes, all
Yep.
that fun stuff. And, we kind of have this like, well, if I don't do this exactly as this is laid out, if I miss one little thing, I'm going to throw the whole thing away. So that
Yep.
it's good you push that a little bit, that it's 85 to 90% because it gives you that extra piece. Because sometimes that's the key that keeps you going,
Mhm.
staying consistent longer than completely giving up on yourself too. And then with the fiber, I did want to ask you, calorie wise on fiber, there's a myth out there, the net carb myth, about fiber.
Mhm.
Doesn't the calories in fiber don't count? I know some of these packaged foods are starting to like tell you that with the low carb craze that went down,
Mhm.
it might have 4 grams of carbs, of net carbs, it'll say. But what that really
Mhm.
does is some pseudo math, I think, that just eliminates what fiber is in there, and I think sugar, alcohol, or something like that, and then whatever carbs are left is what
Mhm.
they advertise at. But if you calorically put it together, it's not true. So what percentage do you think, from your expertise, if you know, fiber, how many calories are we getting? Is it half of the amount we see of carbs, or how are we looking at that on the calories?
I personally, when I talk to my patients, I count every calorie as if it is a full one when it comes to it. And when it comes to the fiber, there's so many different types. So if you have a soluble fiber is actually broken down by our gut microbiome, absorbed. And at that point, it's turned into short chain fatty acid, which is going to have calories to it. It may not have the full four, but it's probably closer to like 2.5 to 3. But it's not an exact science because it depends on each individual's gut microbiome as well. Insoluble fiber, that's the one that's supposed to stay intact. And this is why most people assume that calories don't count. They're counting all fiber calories as insoluble and just going through your colon and working its
Mm,
way out. So personally, when it comes to patients, I have them count all the calories from it. And you have to be careful of these high fiber foods, especially a lot of these keto paleo foods. You'll notice that they list those net carbs and they'll say something's 50, 60, 70 calories and they have about 15 to 20 grams of fiber in them. But they didn't count a single calorie from those. If you did actually count those calories in there, you're usually looking at double what it is.
mm-hmm.
So I don't want people to give themselves a false pat on the back. I want them to be realistic with the food that they're having. And this is another reason why I do try and edge more towards the whole foods because there's no faking it. There's no nutrition label on an apple.
Right.
It's
It's
giving you the
that's it.
fiber and that's it. That's what it is. But these things that they're just trying to sneak protein and sneak fiber into, um, they're putting it into junk a lot of times.
Yeah, they are. They really are. And another piece too. Once you get the fiber and the protein down, another,
Mhm.
I don't know what you call it, cholesterol, right? Like I saw you
Mhm.
talking on social media a little bit about cholesterol. What you had to
Mhm.
say really, it really sounded like you knew what was going on there. I think
Hmm.
I would like to know a little bit more because I have a little confusion myself around cholesterol. There's HDL, there's
Yeah.
LDL, there's the two different
Hmm.
ones. And when you see cholesterol similar to fiber, you said soluble and insoluble. Well,
Hmm.
the label does not break down the LDL versus HDL. Now, I
Hmm.
don't even know at this point. Like, I know there's a lot of cholesterol medicine. I know there's a lot of prescription medicines for cholesterol.
Hmm.
I've heard theories that we don't need any of this stuff. What do you where do you stand on cholesterol, LDL versus HDL? How much emphasis do we still need to put on this?
So cholesterol is extremely important. And I think that a lot of stuff that's out there, that's floating around out there, in the knowledgeable, reputable science community, there is no question. Having your cholesterol controlled is important for preventing heart attack, strokes, peripheral arterial disease, any type of vascular disease in general. When it comes to like HDL, LDL, LDL is traditionally known as the bad cholesterol. HDL is known as the good cholesterol. Realistically, I like to tell people that the HDL it should probably be relabeled to like not bad cholesterol. It doesn't give the benefits that people used to think. People used to be like, "Oh man, my HDL is high, so it helps my heart." It just doesn't have the negative effects that LDL, and there's triglycerides. There's also like a VLDL and a IDL out there. As far as the food labels, they do usually list cholesterol on there, but here's the tricky thing: cholesterol isn't the worst thing in the diet for increasing your cholesterol, even though you would think so. And I can't blame people for thinking that.
Hmm.
It's actually trans fat, saturated fat. Those are much worse. We all tend to have a little bit of a cholesterol threshold, and once we hit that threshold, our cholesterol in our body isn't going up much higher. But when it comes to saturated fat and trans fat, it just keeps on spiking up higher and higher. So those are the things that we want to look at. Thankfully, there's been more of a ban on trans fats. They're not supposed to have them in food, so that's helpful. But saturated fat, it's completely different, and that's another one of those things where the USDA guidelines they're completely inconsistent. They say that they want people to be under 10% of saturated fat, but then at the top of their pyramid, they have like bacon and butter just sitting right up there, and they're advertising, hey, go to Steak and Shake because they make fries and beef tallow. And don't even get me started how we're promoting fast food at this point.
Hmm.
But these are some of the problems that we're having here. But when it comes to cholesterol itself, it is a very important thing for us to look at. They just released within the past week updated guidelines from the American Heart Association, American College of Cardiology, and they are much more in tune with what the current science is. They're recommending certain other markers, which I've already been doing in my clinic. Every single one of my patients already gets this full cholesterol panel and these additional tests called ApoB or apolipoprotein B, and this one that's a little bit more genetic called LP little a or lipoprotein A. And it's important to know these. The LP little a, you could have the healthiest lifestyle in the world. You could be as clean as possible, but this is a genetic test. And roughly 1 in 5 people have an elevation in this. And LP little a is basically like a cholesterol particle that has Velcro on it. And it's going to stick to the walls of your arteries and make you more prone to have heart attacks. So that's important. And those are the people that we probably are going to jump the gun and be a little bit more aggressive with lifestyle, but also we probably are going to jump onto medications a little bit sooner. ApoB is more of like the carrier protein that attaches to cholesterol. And the way I like to describe it to people is like imagine your arteries are a highway and you have to carry cargo down this highway. All the cargo we have to carry is all the bad stuff. So LDL, triglycerides, IDL, VLDL, all those bad things. And then the ApoB is almost like the trucks carrying the cargo. Now, some people they require more trucks. Some people less trucks in that type of way. But the reality is, when you're in a highway and there's too many trucks on the road, what happens? You get a traffic jam, right?
Hmm.
So if you get a traffic jam going to the heart, what's happening? You're more prone to get a heart attack. One going to the brain, a stroke. So that's why the ApoB is a very important thing to look at too, and that's why I kind of look at all these things. As far as the people that are going out there saying cholesterol doesn't matter, I know there's a lot of people on these carnivore diets, which I mean, short term people feel good. They lose some of the water weight from dropping glycogen. But long term, these people are all setting themselves up for heart attacks and strokes. I had a patient about 2 years ago that was 42 that was paralyzed on one side, and he still wanted to keep doing the carnivore diet, thinking that
Wow.
that was going to fix it.
Well, that actually might have been the cause, technically,
Yeah,
due to the fact of that.
exactly.
So, wow. So yeah, I think that's pretty much an extreme diet in a sense. I mean,
Hmm.
that really is. I've looked into that.
Hmm.
I think we do gravitate towards these extremes, and I feel like you probably the
Hmm.
patients that you see have regurgitate this kind of stuff, and I think we've shot
Hmm.
ourselves really hard in the foot based in just not only the food corporation side, you got the medical industry. And then,
Hmm.
even the fitness side of things. Now you've got this pseudo protein stuff. You've got all this. It's like there's so much confusion out there. And I
Hmm.
feel like, what you're doing is really getting people just giving them that clarity of what they really need to see. And I think that's just ideal. It's really amazing what you're doing. So, like for instance, like if I was to have, if somebody like my mother was to look for some dietary changes and wanted to come see you, you're talking, right after surgery. Now she's say 3 years removed.
Hmm.
Is it just basically the same types of things, the protein, the fiber, cholesterol?
Hmm.
It's just doing that over and over again and changing, interchanging foods, correct? And then moving
Hmm.
as much as possible as her body will let her, right?
Yeah, exactly. And that's where I start focusing on a lot of the other things to add on to the nutrition at that point. So it is the physical activity. It is making sure you're getting enough sleep because that's how your body heals itself. It's how it recovers. Avoiding things that, so one of the pillars of lifestyle medicine is avoiding risky substances. So trying to avoid alcohol in that sense. And then mindfulness. So stress is one of those things I can't put a number on it. I just can't put a number on that. So I don't have a scale or a blood test that's going to say, hey, you're stressed in this type of way. I know people start talking about my cortisol is going up. Our body, yes, there are some blips of cortisol that end up going up, but it's not like this drastic change in a blood profile that we're looking at. So it is finding ways to make sure that you're controlling those type of things that you can. For some people, it's meditation. I'm not a meditation guy. I close my eyes and start thinking about all the things I have to do. But for me, some of my mindfulness where I clear my head is when I get in the gym. When I get in there, I'm one of those people that I love just going by myself, being off in my space, doing my own thing. I clear my head. I go through my thoughts. I like going to, if I have time, sauna or steam room afterwards too. Those are great places for me to clear my head. The problem is a lot of times when people are going to work out, they're also between each set. Let's sit on my phone for about 5 minutes and play it. Get in the zone with that and clear your head in that way. So these are the type of things I start focusing on. I like adding these additional pillars that focus on the overall quality of life, mental health to physical health.
Yeah, I like that, and I'm with you on that too. I got to put my phone away at the gym because now that I got it's all wired, it's Spotify, it's streaming, and all of that.
Hmm.
Almost makes me want to go back and just bring a Discman around with me or something like back in the
Right.
day. You know what I'm saying? So as far
Hmm.
as the exercise goes, as the training goes, in your role, because you touch on that with the clients too.
Hmm.
How far do you go with them on that? Like, are you writing programming for them? Are you giving them a
Hmm.
X amount of days and different movements to
Hmm.
do? How far do you go into that? Almost, it sounds like almost you dive into the personal training side of things there a little bit. Is that kind of
Yeah. Yeah. I do kind of dive into a lot of those things. Back in high school, I used to play basketball, and one of the things I always knew was like know your personnel. So
Mhm.
so know who you're guarding and know who you're dealing with. And in this situation, I do the same thing when it comes to each individual patient. Know who you're dealing with. The person that grew up in a house where they never even touched a vegetable, I'm probably not going to be able to get them up to 30, 38 grams of fiber within the first couple of days. It's more so, let's do some trials of certain things that maybe you could try now. You didn't like them as a
Mhm.
kid, but your taste buds change. And the same goes for exercise. If someone is used to just being sedentary and they get winded just going a block or two, then I start talking to them. I'm like, okay, I want you to go someplace where we're going to have you walking, but there's places where you could grab a seat and you could take a break and then you could go again, and I want you to just do a couple loops and just every week I want you to bump that up. And then I have the people that are a little bit more of fitness junkies, and they go to the gym and they just go. And that's great for most people, and I think just getting there is a huge battle. But some people want to be fine tuned now. Like, okay, I want to improve my cardiorespiratory fitness. I want to improve my strength a little bit. And I'll dive into talking about doing zone two cardio, doing a VO2 max workout, but making sure you're doing the strength training as well.
Mm.
So when I start people that have like no real plan, but they are ready to go to the gym, let's say even the 6 days a week, I call it my 3-2-1 rule. And I do 3 days of zone two gentle cardio, just getting your bearings. 2 days where you do a full body workout, and then 1 day VO2 max. And I kind of go into a different type of VO2 max workouts, the ones that I do. And I'm like, that's a starting point. Now, what are your needs? Are you trying to build more muscle? Then I want you to start expanding on that. And what we can do is we could have you do make your warm up a little bit of that zone two cardio, or maybe you could end your strength training workout with a little bit as well. And if we get to enough days in the gym where you're doing the strength training, that we can start dividing it out. If you're only going 2, maybe 3 times a week, I like doing the full body workout. But once people start going to the 4, the 5, or the 6, that's when I start doing more of like the push pull leg day, and I start talking through that. And you know, obviously, I'm talking to them in office. I'm a sounding board where they can reach out to me and I could give them feedback. But for some people, they're like, I need someone to guide me through the workouts. And I'm like, you still probably would benefit from a trainer or a coach in that type of way. One thing that's kind of awesome is the gym I go to, I bump into a lot of my patients. And one of the greatest things for me is when I see them doing a workout that I explained to them in the office that they had never done before and never heard of before. Whether it's a machine or free weights, it's a great feeling.
It really is, isn't it? Isn't it just feeling like you really made that difference, and that's just what life's all
Mm-hmm.
about, really, you know? And I did want to ask too, in your role, and I sometimes feel like that in mine too, doing the nutrition consulting or the personal training, and it's told
Mm-hmm.
to us in our certification too that when you run into somebody that may have a eating disorder or maybe a mental illness of some sort, because that plays a huge role in how people eat, is their
Mm-hmm.
conditioning, their past traumas, all of these things. At what point in your profession? Because I have to immediately, if that's something I suspect, I have to, I can't do anything about that myself. Um, o-
Mm-hmm.
Outside of just some friendly talk, you know, to them. But like, if it gets really bad, do you have to refer them to a behavioral therapist or a different type of doctor for eating disorders, or are you actually able to go ahead and tackle that yourself?
So usually when there's eating disorders involved, I usually try and involve behavioral health immediately. I do have training to manage some of it, but full on anorexia, bulimia, those are things that it would be inappropriate for me to just do on my own. You know, when it comes to if there's someone that has this type of disorder eating, a lot of times I will just pull the plug on any of the diet talking. I'm like, you know what, I think we need to get you working with someone else.
Mm,
Usually I'll do a behavioral health referral, but also a nutritionist, a dietitian to kind of dive a little deeper to work with them. But it's making sure that they don't hit the extremes. I
yeah.
usually check in on these patients a little bit more often as well. I like going through the logs with them as well to talk through certain things. And a lot of times I try and just turn those visits into let's take away the boogeyman. Let's take away what's scary and be like, what are you afraid of? All right, I'm not afraid of these calories. I'm not afraid of, you know, some people are afraid of potatoes. That's like a big thing. I'm like, I'm not afraid of potatoes.
Mhm.
Go ahead and eat your potatoes. Just quit frying them all and then adding sour cream, bacon, and cheese and whatever else to it, and turning that 150 calorie potato into 500 calories.
Yep. Yep.
That type of stuff. So I just try and take away like these fears in food because there shouldn't be food that you're afraid of.
Hmm.
There should just be food that you're just like, okay, this is something that I've just got to be in moderation. Okay, I wanted cheese. I'm going to sprinkle a little bit on there. But making sure the crux of your plate and the things that you're having are those healthy foods. So I try and make this less scary than this diet industry and this food community has made it
Hmm.
all.
Yeah, it really is. They struck a lot of fear. It feels as if there's no like I don't want to say the word moderation right now, but like it seems like there's this all or none. Like it's either good or bad. You either have to pitch it or not.
Hmm.
And a lot of times, you know, olive oil, for instance, is a very healthy fat, and that's what it's promoted
Hmm.
as. I do think a lot of people have a distorted idea of what healthy is. I mean, when they're asking about it in a dietary sense, as far
Hmm.
as body composition goes, sometimes I feel like they're asking me, "Can I eat as much of this as I want without thinking about it?" And so
Hmm.
with olive oil being a healthy fat, I feel like,
Hmm.
they could just pour it all over, but boy, that's a lot of density right in there.
Yeah.
And, so I will say that to somebody. They're like, oh, so olive oil's bad. I shouldn't have it. I said, no,
Hmm.
you have to moderate it and put it on a food scale and do that.
Hmm.
Are you doing those
Yeah.
kinds of things? And are you promoting like weighing and measuring the food as well with what you're doing too? Or are you just first start with just, hey, we got to flip what you're having completely and don't worry about the counting at this point? Which way do you
Yeah.
start?
So that's one of those know your personnel situations. So the people that are ready for it, that are ready to track each very in depth, I do to go into let's talk about the macros. Let's talk about weighing your food. I kind of explain some of the differences. I'm like, take a look at that pan spray, and it says 0 calories, right? And and
Mhm.
look at what the serving is.
I
It's
love
like
this.
1/38th of a second.
Try to
It's
count
insane.
that. Yeah, yeah.
Yeah,
It's
right.
hysterical.
So it really is. It really is. So like oil is a big thing that I talk about.
Right.
I don't have this fear of seed oils and those type of things. The science doesn't have fear in that. But I do have a problem with people over consuming them. And most of these oils are consumed in these heavily processed foods.
Hmm.
When it comes to oil, the way I talk to people, I'm like, I like for you to avoid it as much as possible. But if you need it, if it's going to get someone to eat veggies, then yeah, put some of that in the pan and cook up those veggies. I'm okay with it. But I also will start pointing them in the direction of like there's certain spray bottles now that you could purchase on your own, fill with olive oil, and they will truly give you a set serving that is going to be about like half a tablespoon and things like that. That helps you control it versus that. And I mean, I'm Indian, so in our Indian culture, like we don't measure food. We just pour it all in until our heart desires, and that's just how we grew up. But when it comes down to it, that's where most of these sneaky calories come in. Nuts are another good example of a healthy food that are easy to overconsume. I mean, you grab a handful and you throw it in like it's a bag of chips, and then you just keep going. Nuts are great, but a serving is that one
Hmm.
handful, that one little fistful right there, and we should probably just leave it at that. I mean, I vouch for a serving of nuts or seeds a day because there's data about that benefiting cholesterol. But when you start going above and beyond that, or you do these things like there's all these honey roasted nuts, they add all these seasonings, and it's less nut and more junk than
Yeah.
anything else.
And the poison's in the dosage as usual, per usual. So it's
Hmm.
really how much of it that you're doing. And like speaking of those spray bottles, I do think that those labeling laws do a disservice to people because when
Hmm.
you market at 0 calories like that for 0.3 eighths of a spray or whatever it is, the reason they
Yeah.
have it like that is because they're able to round down. So if that serving is actually 4 calories, they can call it zero. That's what I was
Hmm.
told. And
Yep.
I think that's actually a big disservice, especially when you go for. I don't think they should allow anything to be advertised as zero per serving because I just think
Hmm.
it doesn't make any sense. Like I've seen a drink, it's a big bottle, and it was not a lot of calories, but it was 0 calories for is it was 3 servings in there, and it was 0 calories for a serving, but it was like 15 or something or 10 for the whole bottle. Like that doesn't make any mathematical sense. Like that, like what is that? Why are they doing that? Do you have any idea why they do that on the labeling laws? Is that a sales thing? I don't know.
It's a sales thing. Honestly, our entire food industry is just doing a disservice to all of us. I mean, the reality is it's profits over whatever's best for for the people.
Hmm.
So if someone's trying to sell you Doritos, they're going to get strategic with how they're going to sell you Doritos to make them seem a little bit healthier for that subset of people that are trying to watch their calories. These companies, they hire food scientists and they hire them to hit this like bliss point in food too. So it's
Hmm.
that perfect amount of sweet, salty, and fat that everyone's craving and looking for. It really is terrible. And then the way the government is set up too, and every 5 years, let's have some new USDA guidelines. And initially, it starts out with scientists that come up with like this is what the science makes sense. But there's actually a moratorium in between where people could lobby. And most of the lobbying comes from these processed food companies, dairy, beef. These are some of the biggest companies. If you look at where their funding goes and who they're paying, it's a lot of the people making these decisions at the end. And then they come up with the final print of it. If you looked at the guidelines here compared to like a lot of European countries or even Canada, they are a lot closer to the science because there is a lot less of that influence in there.
Yeah, and I know they're trying to make some changes in the current administration, but I don't talk politics on here too much,
Hmm.
but I don't know if that, like you kind of mentioned it in the beginning with the seed oils, the red dyes, and things like that, and upping the
Hmm.
nutrition content or a curriculum for doctors to 15 extra hours. It all
Hmm.
sounds freaking good, but
Yeah.
it's not going to really do much of anything. My concern is that if is by like say we're going to eliminate and clean up this processed food, yeah, you're going to take out a few things, but to me that almost seems like it's going to entice people to think it's okay to eat this low
Mhm.
satiety food, and that doesn't do, that yes, it's cleaned up, but you're still eating low satiety food with low nutrients, right? Like it's really not going to
Yeah.
do much. It's my opinion. I don't know.
Yeah, Cheetos without dye are still Cheetos. It's still
Right.
processed food. A Twinkie without any without seed oils are still a Twinkie.
Hmm.
So the reality is, it's not. They're actually it right now. What they're doing is they're rearranging the chairs on the Titanic. Okay, they're not really doing anything that has value for all of us.
Hmm.
So we need to first we need to focus on trying to get access to these type of healthy foods for people. We subsidize the wrong things. Like, why is it that I can go get like a burger from a place at a fast food spot for a couple bucks, but then if I wanted to get a fruit tray, it's like $13 at the grocery store.
Yeah.
And I'm just trying to sit here, be healthy with the foods that I'm having. And not everyone's like a chef, and they have the culinary skill set. So a lot of these people are going for things that are closer to being ready made. And if you do something that's ready made that is more whole foods, it's going to be more expensive. So we have our money allocated in the wrong things. And then for these people that live in these communities that are food deserts, like all they have is like some convenience store or bodega there to get their food. And they don't have a lot of produce there. So of
Hmm.
course you're going to get the packaged goods and have that type of stuff. So yeah, doing that, cutting, saying SNAP benefits can't be used towards junk food, sometimes that's all these people have access to at that point. And honestly, if I'm financially hurting, a Little Caesars pizza that could feed my family versus like getting that meal that is going to be truly nutritious, it for them to their finances are going to say, I have to do this because at least it's food on the table for my family. And I don't think people are trying to do ill by themselves or their family. They really aren't. And there's actually studies that showed that when they provided food to people in these type of communities that were healthy foods, and they gave them the option, it's going to cost you the same amount for this or this junk food, people were starting to gravitate towards the healthier options once they got there because they realized the benefit in all this stuff.
Well, that's good to hear, and hopefully promising for something in the future. But I don't know because money talks way too much. So I
Hmm.
always had this. I don't want to call it an argument. I know the answer to this is both, but like, given that we pretty much have somewhat of an obesity epidemic here in the United States, especially, and getting
Hmm.
out of an obese state is one of the best ways to reduce your risk of chronic illness. Should we,
Hmm.
when you start with a client, or a patient, I should say, um,
Hmm.
do you focus more on quantity or quality? Because it feels as if the quantity is going to dictate the body composition, the quality is going to
Hmm.
heal you internally, and whatever else has to happen there. What's your approach on that and your take? Is there a way you go?
So you're right. The answer is a bit of both when it comes down to it. It depends on the patient I'm dealing with and how obese they are. I do tell them that from a weight standpoint, it is always going to come down to a calorie deficit. But if you ate nothing but 1,000 calories a day of Twinkies, you're going to lose weight, but you're probably going to hurt yourself metabolically.
Hmm.
So I do go into a discussion of, okay, so let's start with the food log with you. And I start out by pointing out sneaky calories, where things are, and usually it's like these oils, and that, like this is where people think they're being really healthy. Like, okay, you're having hummus. Hummus is really healthy, but did you check the portion on it? Like, well, I had like half the container. I'm like, so you just had 5 servings of hummus in one sitting. So it is diving into both of those because for me, the big importance is I'm not just looking for that fit looking physique. I want to see that. Plus, I want people to be metabolically healthy, so they're reducing the risk of heart attacks and strokes and all these things.
So yeah, it's just got to be a little bit of both ends where we're doing that
Hmm.
because I know habitually, it's hard to break those eating habits that people have. On my end of things,
Hmm.
sometimes I will do my best to keep it familiar, but less, but keep it controlled to start, and then take things out and try to change the diet more of the quality wise. So, but
Hmm.
no, either way, it's got to happen either way. So, as far as like, say the future goes for you, I know you gave us your progression here where you, in 2018, you
Hmm.
made a change and then you had your scare in 22 and now you're continuing on here and you got a practice going over there. What do you got
Hmm.
anything else? Is there anything in your future for you that you're looking to do, that you're looking to go do more of with this, or uh, just curious?
So, honestly, part of the reason why I wanted to be on this podcast is I'm just trying to spread the word. I obviously want to do it with my own individual patients, but I think we need more community awareness. We need more sound minds that are actually being vocal and speaking up. And in various spaces like the social media space, I know a lot of the smartest people I know that are afraid to dive into the space. And I get it. We aren't trained in this. We're like, well, see our individual patients and keep doing a good job. But the reality is some of us have to get out there and do things and get the sound evidence out there. So for me, I actually am hoping to. I don't have like a scheduled speaking tour or anything like that, but I've been presenting at various conferences. I'm going to be presenting at the Food as Medicine conference in Chicago this May. I got asked to present at a conference in Cleveland, Ohio, the Vital Signs Conference. It's Dr. Caldwell Esselstyn, who's like one of the godfathers of nutritional medicine and preventive cardiology, is going to be presenting at, I think he's 92 years old. It's pretty
Okay.
impressive.
Wow.
But I'm looking to do more talks like this to show people that it's not scary and you don't need some crazy cleanse or detox. It is coming down to the basics, but having someone that could work with you, that's someone that's going to help keep you accountable, that's going to help correct things in that type of way. And you know what? Great. If it's me, that's awesome. It really is. But I also want people that don't have access to me or don't have me that are able to just find someone that will do these type of things because we're all capable of it. We just need the right supports around us.
Yeah, no, absolutely. And it's we need more people like you out there, I think, to kind of take this mentality and roll with it and show people that this, diet industry and this food corporation stuff is really convoluted everything and it's a lot simpler, like you said. It's simple, but it's good to have accountability. And I tell everyone, go see somebody like Dr. Sharma because, asking for help is a strength, is my opinion. It's,
Hmm.
asking for help is a strength. It's not a weakness. A lot of times we get too
Hmm.
proud and too ego driven to where we don't want to do it. Just go and do it. If you feel like you need something like that, please do. So, and
Hmm.
to contact Dr. Sharma, best place would be your website. Is that right? Is that a good spot for you? Is that sunnysharmamd.com? Is that a good
Yep. Yeah,
place?
there's a way to contact me on there. You can leave your information and I'll be able to reach out to you. If people want to call my office directly, they could also call it 224-273-6010. For people that aren't my patients, it's not like you call and you're like, I have to pay and sign up right away. I actually do free meet and greets for everyone, and I encourage that. I want people to make sure it's a right fit for them. This is an investment. Your health is an investment, so I want to make sure that people feel like they get the right value, and this is going to be the right thing for them. But I also want to make sure it's the right patients for me too. I've had some people that were just looking for a doctor that they hopefully get established with. That all they were going to do was like I was going to prescribe them testosterone or a lot of these weight loss medications. I'm not opposed to, in the right situation and the right circumstances, these medications at all. But I want to make sure that because I literally had someone telling me that don't want to exercise, I don't want to worry about dieting, I just want to lose weight, and I'm like, that's not the approach that I go with, and that's just not how I'm going to go about things. So
Yeah.
I could give you some other referrals.
What do you just kind of jogged something in my memory in my mind here about Ozempic. We didn't talk about Ozempic today.
Mhm.
What are your thoughts on these GLP-1s, this Ozempic and everything that's kind of going crazy here? We're hearing a
Mhm.
lot of dangers about it, and
Mhm.
I'm on that camp a little bit. But what's your take
Mhm.
on Ozempic and things like it?
So I know some people are going to be mad hearing this, but I actually think they're great medications when used correctly. The problem is the vast majority of these are not being done correctly. All these compounding pharmacies that are selling them, these online retailers, basically you pay to play. You pay to get your prescription, and that's it. You're not getting appropriate nutritional education. Nobody's talking to you about how much protein you should have to make sure you're preserving your muscle, the strength training you need to do, because as you lose weight, if you're just losing weight without the activity and working your muscles, you are going to lose muscle mass as well. I actually feel like without a comprehensive plan, it's basically malpractice to me. So I do have a lot of patients that I'm using the GLP-1 medications, but it is also a full, comprehensive, all-encompassing plan. We check in frequently. We are talking through various exercise regimens. I am encouraging more strength training on those individuals. I am also talking to them. It's like, you're going to want to eat less food, but that doesn't mean the less food is going to be ho-hos and Twinkies. That less food, I want it to be actual nutritious stuff. We're going to get your fiber. We're going to get your protein. We're going to make sure you get your vitamins, your minerals in, all the appropriate things that you need. So when it comes to those, I'm in the camp that I'm not afraid of them. I am comfortable with them, but I can't say that most of these patients that, and no offense to other primary care docs, they only have 10 to 15 minutes. How are they going to talk to them about the entire process of going on these medications?
Right. All they can really do is say the usual, hey, make sure you're still exercising and eating healthy. That's probably all they can really do. And then
Mhm.
I also wanted to ask too, and we were talking about seeing patients. Do you do just local, or are you virtual as well? Is anybody capable of being a patient of yours? Is that correct?
Mhm.
So,
Yeah, I'm actually pretty well versed in telehealth. A lot of my patients love the telehealth option. Anyone that signs up with me, you get a separate wellness visit, and in that, you get all these extra labs and things like that. You'd obviously have to come in person because we do ultrasounds of the legs, EKG, breathing tests, grip strength, all this intense stuff that you don't normally get.
okay.
But I have a lot of patients in between then. All other visits they do virtually with me. And even for people that come in to do that testing, I go over the results 2 weeks later once I get all the blood tests back. That could be done virtually as well. So I do have a lot of people that take me up on that offer. And I think sometimes it works out a little bit better. It gives me an opportunity to even see like the environment they're in.
Hmm.
And it's like, how much room do they have? Oh, you got a room right back there that you could actually do some body weight exercises. Let me talk to you about some of them.
Hmm.
So it's kind of cool to see. And I actually, even I've had people be like, okay, what did you have for breakfast? I'm like, hey, go grab it, bring it here, put
Hmm.
that label up there. Let me talk you through it and explain what each of these things are. So there's something about being in that home environment that helps people out. And I have plenty of older patients, like I told you, that aren't as well versed in technology, and that's okay. We're
Hmm.
able to. I even talk to them on the phone if need be, but most of them prefer just coming in.
No, that's really cool. They're really covering all the bases there and everything. So, before we kind of close it up a bit, is there anything else? The floor is yours. Anything you'd like to say, put out there in any other fashion? I want to make sure you got any messages you want out on this recording here, sir.
I think the one thing I just want to emphasize for everybody is the best way to treat disease is prevent it in the first place. And that's why you have to find a doctor or a medical team or coaches, people that are going to work with you in this aspect of things. So obviously, I would love to take more people on as patients as long as I have the capacity. But if not me, just find someone that will work with you, talk through this stuff with you, and is looking at your overall health.
Perfect. Well, so I'm very appreciative to have you here. I was thoroughly engaged in this conversation, and you clearly have an unbelievable expertise in this. And whoever comes to you as a patient is in great hands. Just from speaking to you, I could tell that's good. That's amazing. So thank you for what you're doing. And as we kind of close it up again, it's sunnysharmamd.com. I will put that in the show notes. So if you need to look at it up there, if you need to get in touch with me, I'm on social media, Instagram and Facebook at MFS Wellness. You can also message me by email, Mike at mfswellness.com. So for Dr. Sharma, I am Mike, and we'll talk to you on the next episode.